Hi, everybody, and welcome to our Safer Prescribing and Dispensing info session about the strategies that we have offered to you as part of the Ulster County Healing Communities Study. So just briefly, for anyone who may not be aware, the Healing Communities Study is a test of the integration of prevention, overdose treatment, and medication-based treatment in select communities hard hit by the opioid crisis. The Ulster County was one of several communities chosen to participate in this study. This comprehensive treatment model will be tested in a coordinated array of settings, including primary care, emergency departments, and other community settings. Findings will establish best practices for integrating prevention and treatment strategies that can be replicated by communities nationwide. So together with many partners across Ulster County, we have discussed and created and are now implementing about over 25 different strategies in medication for opioid use disorder, naloxone education and distribution, and safer prescribing. This info session is about the 3 strategies that we have laid out under safer prescribing and dispensing. So one of the safer prescribing strategies that we have is DisposeRx medication disposal packets. The exact strategy is by July 2022, we want to expand safer opioid disposal practices by providing 18,000 medication disposal packets to at least 1 Ulster County pharmacy and 3 providers to give with every opioid prescription. This strategy has shifted a little bit since its inception. Originally, we wanted to offer it to pharmacies, but we felt that it might be best if providers offered them as well. So the number 18,000 we got from surveying all of the pharmacies in Ulster County and developing an average number based off what they told us that they believe they dispense in a year. 18,000 opioid prescriptions in Ulster County a year, average rounded about. So we ordered that many, and now we're trying to get it out to our community at the root when an opioid is prescribed. So I am going to play this video so you can see how DisposeRx packets work.
Most Americans are unaware that 70% of new addictions begin in the home medicine cabinet. Unused, unwanted, and expired medications are contributing to over 190 deaths per day. According to the Journal of Drug Abuse, 89% of consumers are looking for a safe and convenient way to dispose of these unwanted medications. Meet DisposeRx, the future of drug disposal. DisposeRx is the most tested, most convenient in-home drug disposal solution available. Using DisposeRx packets to clean out your medicine cabinet breaks the cycle of drug abuse, misuse, and diversion. Leftover drugs remain in home medicine cabinets for an average of 3 years. That's 1,095 days of opportunity to contribute to a new addiction. According to the Center for Disease Control, nearly 64,000 overdose deaths occurred in 2016, more than the number of men and women lost during the Vietnam War. Over 42,000 of these deaths involved opioids. DisposeRx is a simple, effective, and affordable way to get drugs out of the home. Using DisposeRx is as easy as 1, 2, 3. Open the vial of leftover pills, fill to 2/3 full with warm water. Add the DisposeRx powder and shake vigorously for about 30 seconds. Almost immediately, you'll notice that you can no longer hear the pills rattling inside the bottle. They're being sequestered by a patented blend of cross-linking polymers that renders the drugs unretrievable for all practical purposes. DisposeRx is environmentally friendly and can be tossed in the household trash. The future of drug disposal is here. Please join DisposeRx in breaking the cycle of addiction that begins in the home medicine cabinet. DisposeRx, site of use in-home drug disposal for safer homes and stronger communities.
Okay, so as you can see, the box is relatively small, and this box alone has 100 packets inside. These packets are very easy to distribute, very small, weighs next to nothing. So realistically, you could have one of these boxes in every office and it wouldn't take up a ton of space. So what's required if you participate in this strategy? is we're hoping that you could let us know the number of providers in your practice distributing. If it's just you, that makes things easy. And the number of packets distributed, that's it. And we're happy to help in any way possible to help make this reporting easy on you. With a lot of the people participating, we found it easy to just give the practices a small amount of boxes, perhaps starting with 1 or 2. And then when you need more, we know you distributed however many were in those boxes. So we can make it that easy. Really not that difficult at all. So what does this mean for you? These packets are very small. They require very little space in your office. You can keep them in a drawer and simply hand them to a patient with the description card to your patient. We offer you description cards that are 5x7, has extra directions and fun facts and information. And on the back, it has a QR code that the patient can scan if they want another one. Awesome, Danielle. Thank you so much for holding that up. So after they use that, they can always request another one. We'd be happy to connect them to someone who can give them, whether that's us or a partnering organization. There's plenty of places that people can get these packets for free. So you can also use this as an opportunity to discuss opioid safety, awareness, and proper disposal practices with your patients. Like the video mentioned, many people hold on to their prescriptions. So when you write a prescription and you hand one of these disposal packets with that prescription, you could say, hey, if you are not in pain by day 4, get rid of them. You know, don't hold on to them. That it really opens up that door for that conversation. So our next strategy is our patient education zine. So this will be available in late January or early February 2022. We are in the final stages of having it edited and it's being sent off to be printed. They can be given with opioid prescriptions and just like hosted in your lobby. So to participate in this, all we need is for you to say, yes, drop them off. Really, really easy. So if you're interested in this, please let us know. These zines also have a QR code on the back, and that's how we're going to track how many are distributed. We don't need you to keep track of that. So just having them is amazing. On the form that people can fill out, they can say if they learned something new, if they're glad that they received it, and also where they got the zine. And we're starting a program in the Ulster County Department of Health and Mental Health, where if we get a lot of forms back saying that they received, that multiple people received a zine from your office, we, if you're comfortable, will highlight you as a star provider in Ulster County, star educator around opioid prevention. So we're happy to acknowledge your dedication to these efforts. So the actual strategy for this is by July 2022, enhance safer opioid prescribing and dispensing practices by providing pocket-sized patient educational booklets on opioids and opioid use disorder, including information on alternative pain management options to be distributed to 1,000 high-risk individuals with opioid use disorder and reduced opioid tolerance through at least one provider in each of the following specialty areas. So we surveyed and we found out that a lot of people are receiving opioids from the dentistry area, orthopedics, surgery, and OBGYNs. So if we could have at least one provider in each of these areas take on these books, that would be amazing, but we are always happy with superseding that. So here's an example of a spread in the zine. Ulster Prevention Council offered in-kind services to design this. So essentially, the idea of the zine was there are so many leaflets and informational things that have so much information. It can be really overwhelming for someone to peruse all of them and become an expert. So we did that for you and the patients. And we pulled what we thought was the most useful information and we combined it into a little pocket-sized pamphlet. We're calling them a zine. And we designed it to be really friendly and fun to just flip through. Any page you flip to is going to have something useful. And it's not really expanded paragraphs. It's condensed bullets and it's got pictures. So fun to look through. And even if you just look at it for 2 seconds, you're going to walk away knowing something new probably. Our third strategy and final strategy is our provider-patient FAQ. So the strategy is, by July 2022, 10 providers will improve safer prescribing practices by utilizing a patient and provider curated opioid fact and recommendation sheet during office visits where opioids are being considered. Another pretty easy strategy. We're just looking for 10 providers to commit to having this FAQ in their office and to using it when they prescribe an opioid. So for example, you have a client, you believe they need an opioid. We want the patient to feel empowered to make these decisions with you. And by doing that is you would take this sheet, hand it to your patient and say, take a look at this. Any of these questions resonate with you? Would you like me to address any of these? And this strategy kind of came to be when we had the realization that many patients can't think of all of the questions that they would want answered in a quick sit down with a provider. And that's no one's fault. Oftentimes you're prescribed a medication that you're not expecting to get prescribed. That's no one's fault. And then when you're in the car and you're driving to the pharmacy and you're thinking about this, now you're thinking about all the questions you wish you could have asked. So we created this FAQ by surveying our Ulster County residents. And on that survey, we asked, have you been prescribed an opioid before? If so, what's one question that you wish you would have asked? And these questions are as a result from that survey. So these are real questions from real people in Ulster County. And we're hoping that it can help foster that discussion. And attached to this FAQ, we actually consulted with Columbia University, who was partnered with us on this study, and we had them answer all of these questions. So if you don't feel confident in providing a response to any of these, do not worry. If your patient wants one of these questions answered, you can refer to a 7-page document that we created answered by the Columbia University medical team so that you can feel confident in giving a response to your patient. All of these strategies are free to participate in. So if you're interested in playing a role in any of these strategies, please reach out to me and I will get you connected to our partners at Ellenville Regional Hospital or Ulster Prevention Council and make sure that you get any of the materials you need, whether it be the zines, the disposal packets, or the FAQ. The FAQ I can send over immediately via email, so very easy. I also want to highlight the importance that this study is over in July. So if you want to participate, we encourage you to reach out to us as soon as possible so that we can get you involved quickly. We have the most important one that we have right now is that we have these 18,000 medication disposal packets in our offices ready to go. So we can get these to you immediately and we want to see them distributed by July. So your participation is critical. And again, data reporting sounds complex and a hassle. We're going to make it completely easy for you. So if you have any questions, feel free to reach out to myself at the email listed on the PowerPoint.